am Dr. Marian Fernandes. I work as an associate consultant in the Department of Surgical Oncology in Aster International Institute of Oncology, Aster CMI Hospital. Cancer screening tests help to find cancer or precancerous areas early. Sometimes these tests find things before you may even have symptoms. Cancer treatments are the most successful when cancer is found early. For example, during your routine dental examinations, your dentist should look at your mouth and tongue for any changes. This is a small form of oral cancer screening. Males in general should also be screened for prostate, testicular, colon, and skin cancers. If you are a smoker or have a history of smoking, you may also want to have a lung cancer screening. Some general cancer screening recommendations for males. Prostate cancer screening. Always talk about the risks and benefits of prostate screening. Screening tests include a small blood test in the form of prostate-specific antigen, PSA, and or a digital rectal examination. If you have had a brother or a father with prostate cancer before they were 65, you should consider about prostate cancer screening at the age of 45. Also discuss about your risk of familial prostate cancer screening and genetic testings. Testicular cancer screenings. Most testicular cancers happen between the ages of 15 and 45. Get familiar with the look and feel of your testes. Report any changes, swellings, lumps, bumps, or any abnormal discharge. The easiest modality of screening is by getting an ultrasound of the testes. Colon and rectal cancer screenings. There are many different types of screening tests used. Individuals at an average risk for colorectal cancers should begin screening at the age of 45 years. Now, when I say average risk, it means you have no personal history of colorectal cancer or polyps. You do not have a family history of colon cancer. You do not have a history of ulcerative colitis or Crohn's disease. And you do not have or suspect any family hereditary colorectal syndromes like familial adenomatous polyposis or HPNCC. An individual at an average risk for colon and rectal cancer is screened usually by stool for occult blood and getting a full-length colonoscopy after the age of 45 years to up to 50 years. Lung cancer screenings. Most people do not need lung cancer screenings. There are some people who are screened for lung cancer because they are at a higher risk because of their smoking history. Screening is done with a yearly low-dose CT scan of the chest. You may be eligible for a lung cancer screening if you are 50 to 80 years of age and in fairly good health. You smoke now or you have quit within the past 15 years. You have at least a 20-pack year smoking history. Now, a pack year is the number of cigarette packets you have smoked each day multiplied by the number of years a person has smoked. So for someone who has smoked a pack of cigarettes per day for 20 years, he has a 20-pack year smoking history. Smoking cessation counseling is as important as screening. Skin cancer risk. Skin cancer is very common and the rates of skin cancer continues to rise. You may find skin cancer early by knowing your skin and your body, looking at birthmarks, moles, and freckles. If a mole has changed in size, shape, or color, if it is bleeding or it itches or is scaly, please go to your nearest doctor and get your skin tested. We recommend every year for a wellness checkup for all males. During this visit, you should or you may be screened for some cancers. Your doctor will talk to you about your family cancer history and if you have any genetic mutations that put you at a higher risk for some of the cancers. This will ensure that your doctor has a plan for you when and how often you need to have a cancer screening. For this topic and further information regarding cancer screening in males, you can always come to Aster CMI Hospital to the Department of Surgical Oncology at Aster International Institute of Oncology. Thank you.